Hi, my name's Claire and I'm a registered nurse and a patient care advisor here at MedBelle. My team and I are here to support you through every step of your journey, and we've made this short video to make sure you're fully informed about your upcoming treatment. Cosmetic surgery can be a significant, life-changing event. So not only do we help you to find a fully qualified and experienced surgeon, but we also think it's important for you to understand exactly what's involved. The information we provide in this video is generalised to all our patients. Because of this, it's important to recognise that your surgeon is the best person to give individual advice about surgical techniques, post-operative care and the risk of complications. Nonetheless, having a good understanding of your surgery means that during your consultation, you and your surgeon can focus on talking about what really matters to you, which is, of course, what you hope to achieve by having the surgery. So, let's get started. The medical term used for a breast reduction is a reduction mammoplasty. The aim of this procedure is to decrease the size of the breasts by removing fat, breast tissue and excess skin. In order to produce the best possible aesthetic for your breasts, your surgeon may also combine the reduction with a breast uplift. The uplift will involve lifting and reshaping the breasts, then repositioning the nipples so that they're aligned with the new position of your breasts. The surgeon may also choose to reduce the size of the areolas if this is appropriate for you. The completed procedure should result in smaller, more shapely breasts. Depending on the degree of reduction needed, the time it will take to perform the surgery can vary between 1 to 3 hours. When it comes to the surgical procedure, a breast reduction involves 2 separate steps: a skin incision and a tissue removal technique. The choice of which type of skin incision is made is separate to the choice of which tissue removal technique is used. This means that there's actually quite a large variety of different combinations of these 2 steps that can be used for your surgery. There are several different skin incisions that can be made to perform a breast reduction. Your surgeon will select the most appropriate method for you by assessing the following points: the size and shape of your breasts, the size and position of your areolas, any breast sagging, and the quality and quantity of your skin. There are typically 3 places in which the incisions can be made: the circumareolar, vertical, and inverted T. A circumareolar incision, also called a donut incision, is a single incision made around the full circumference of the areola. This incision is typically used for very small breasts with mild drooping and only a small amount of excess tissue that needs removing. A vertical incision, also called the Lollipop incision, involves making 1 incision around the full circumference of the areola, plus a second incision running down from the bottom border of the areola to the crease of the breast. Now, this incision is typically used for small to medium-sized breasts with mild to moderate drooping. And finally, the inverted T incision, also known as the anchor or wise pattern. This involves making 3 incisions. The first 2 are the same as those used in the Lollipop technique, and the final incision runs horizontally along the breast crease where the underwire of your bra would be. This technique is often used for larger sized breasts with a large amount of drooping that need a greater amount of excess skin to be removed. The choice of which skin incision is used will not affect your ability to breastfeed, but it will represent the appearance of your final scar. Your surgeon may also suggest sending a tissue sample to check for any abnormal cells before surgery. This is often optional for most patients, but it might be a good idea if you're over 45 years old. There's a wide variety of tissue removal techniques that can be used. The most commonly used are the pedicle techniques. These procedures involve leaving a section of breast tissue called a pedicle attached to the nipple and areola. The pedicle contains a blood supply, nerve supply, and the milk ducts. By keeping these attached to the nipple and areola during the procedure, there's actually a better chance of preserving nipple sensation and increasing the chances of breastfeeding post-operatively. The pedicles can be placed in one of 4 positions. An inferior pedicle is positioned below the areola, where there's a large nerve supply. This can be combined with an inverted T incision for use in the larger breast reductions. A superior pedicle is positioned above the areola, and this can be combined with a vertical skin incision for slightly smaller breast reductions. A medial pedicle is positioned to the side of the areola closest to the chest, and a lateral pedicle is positioned to the side closest to the arm. Another technique that can be used for breast tissue removal is a free nipple graft. This involves removing the entire nipple and reattaching it to the breast after the excess breast tissue has been removed. This can result in poor preservation of nipple sensation and a greatly reduced ability to breastfeed post-operatively. It's important to be aware that cosmetic surgery is actually individual to each patient, meaning that what you need may differ to what another patient needs. And your surgeon's always in the best position to be able to tell you exactly which combination of techniques is best for you. How you prepare for recovery depends on how physically demanding your daily life and work routines are. Your surgeon will advise you specifically about the timeframes for recovery and when you can restart normal daily activities and exercise. But as an estimated, generalised guide, we advise the following. If your job includes a lot of physical activity, for example nursing, waitressing or caring for young children, you need to plan to take at least 2 to 4 weeks off work. If you've got an office job or a job that doesn't require a lot of moving or heavy lifting, we still recommend taking at least 1 to 2 weeks off work. Afterwards, you'll need to be sensible and listen to your body. If it's telling you need more rest, then we recommend you stay at home and pop your feet up. If you've got young children, you'll also need to get your family to pitch in and help out. With regards to exercise, we recommend in the first month you don't exercise at all. In particular, you need to avoid strenuous activity and heavy lifting, but even basic aerobic activities can lead to an increase in swelling. After 6 weeks, you can restart aerobic sports that don't include heavy lifting or excessive movement, for example cycling, but not a triathlon or a spin class. And after 8 weeks have passed, you can continue all sports and activities again. There are a few other points that you should be aware of when preparing for your recovery. Your surgeon will probably recommend that you don't drive for a period of 5 days up to 2 weeks after your surgery. This is a safety precaution to ensure that all the anaesthetic and analgesic agents have worn off before you begin driving again. The next point to consider is that you may not be able to shower or have a full bath for the first 24 hours up to a few days after your surgery, depending on your surgeon's instructions. This is because it's important for you to keep your dressings and stitches as dry as possible before they're removed. If your surgeon's used liquid skin adhesive as part of the wound closure process, you'll also need to keep that area dry for up to 2 weeks. You'll be required to wear a supportive bra day and night for up to 6 weeks after treatment. And this is to help reduce the swelling and to promote really good wound healing. After you've gone through your initial recovery phase, your body should have healed enough to allow you to see the full, permanent results 6 to 12 months after your surgery. Our post-operative guide contains lots of great tips for recovery, and this will be sent to you before surgery. But as this video and the brochures offer generalised advice given to all patients, we still highly emphasise you should follow the post-operative care advice that your surgeon recommends, as this is specific to you and your recovery. It's important to acknowledge that although your selected treatment is an elective surgery, there are, as with any surgery, risks and complications you need to be aware of. The complications that can occur during the surgical procedure include excessive bleeding, blood clot formation, and adverse reactions to the general anaesthetic. There are also complications that can occur after surgery which you should be aware of. Infections can be quite problematic and have to be taken seriously if they occur. If you are affected, it would become apparent over the first 2 to 3 weeks after surgery. A mild infection, such as a wound infection, would settle down with antibiotics. And of course, the package price you pay for your breast reduction will cover the cost of dealing with any infection. Internal bleeding is another potential complication. This usually occurs immediately after the operation, but can very occasionally happen up to 2 weeks later. If there is bleeding present, your breast would become swollen and tight, and you'd need to return to the operating room for further surgery. You're likely to spend an extra night in hospital and you might be a little bit more bruised than expected, but everything should settle down over time and it's unlikely to affect your final result. After surgery, it can be quite common to experience some alteration in breast or nipple sensation. This usually presents with either an increased or a decreased level of sensitivity around the scar and the nipples. In very rare cases, the surgery can result in the complete loss of nipple sensation, but choosing a highly skilled surgeon will reduce the risk of complications occurring. In most cases, however, numbness and oversensitivity are temporary and they gradually settle down over time. Another thing to be aware of is an issue known as bottoming out. This can occur when the lower half of the breast tissue naturally droops down into a teardrop shape, whilst the nipples stay in their place, and it may make the nipples appear overly high. The extent to which this happens depends on how much breast tissue there is and how heavy it is. It's most commonly seen when an inverted T and inferior pedicle technique are used together, but it can be corrected with further surgery. As breast surgery requires incisions to be made, minimal scarring is unavoidable. In most cases, however, the scars are relatively mild and they'll become really thin and barely visible over time. Although, unfortunately, scars are unavoidable, there are many scar-reducing techniques that can be found in the post-operative guide we will send you prior to your surgery. It is sensible for you to be aware that there's always a risk you're not satisfied with the aesthetic result of your surgery. You may be unhappy with the size, shape or symmetry of your breasts, and it's for this reason we advise patients to choose their surgeon so carefully. Make sure that he or she fully understands your expectations and desires. It's therefore important to be candid with your surgeon about the results you want. We try our best to help with this by ensuring that your surgeon is a highly experienced BAPS or BAPRAS member. Your surgeon will be able to discuss the risk of developing all these complications with you in further detail during your consultation. During a breast reduction, breast tissue containing milk ducts and milk glands have to be removed in order to reduce the size of the breasts. Because of this, your ability to breastfeed after surgery may be affected. Many women are still able to breastfeed after a breast reduction, but this depends heavily on the tissue removal technique chosen by your surgeon. The techniques will impact on your ability to breastfeed to varying degrees. You should therefore notify your surgeon if you are planning to breastfeed in the future, as they can advise you which is the best procedure for you. When you go for your breast reduction consultation, be prepared to discuss the following: why you want your breast reduction, along with your expectations and the desired outcome, your medical conditions, allergies and any previous medical treatments, any family history of breast cancer and the results of any mammograms or biopsies that you've had, and finally your current medications, vitamins, herbal supplements, alcohol, tobacco and drug use. In order to make sure that you're well prepared for surgery, our partner surgeons would like to promote the following advice: smoking, alcohol, a high BMI and any form of drug use, whether medicinal or recreational, can increase your risk of developing complications during and after surgery. In order to reduce the risk, our surgeons strongly advise patients to stop smoking and using all nicotine products at least 6 weeks before treatment. Smoking in particular is discouraged as it increases the risk of infection and it actually delays the healing process. It is also worth noting that several homeopathic medications available over the counter and taken for general well-being can negatively affect the outcome of cosmetic surgery. Such medications include, but are not limited to, those containing ginger, garlic, cod liver oil, St. John's wort and several preparations of multivitamin. We therefore advise that all homeopathic medication is stopped 2 weeks before cosmetic surgery to reduce the risk of post-operative bleeding, excessive bruising and hematoma. After your surgeon has covered your medical history, general health status and medications, they will then examine and measure your breasts, including detailed measurements of their size, shape, skin quality and placement of the nipples and areolas. They'll take photographs, discuss your options, and recommend a course of treatment. And finally, they'll discuss likely outcomes of the breast reduction and any risks or potential complications. Your consultation time is your opportunity to be as honest and candid as possible with your surgeon about what you would like to achieve and to explore whether this is possible. It may also be helpful to ask your surgeon what you can do to help to achieve the best results from surgery. So, now on to what happens next. Essentially, your patient care advisor at MedBelle will be your main point of contact throughout the whole process and will schedule a call with you for shortly after your consultation. This is to discuss how the consultation went and to start planning your treatment journey for you. You'll also receive an email from us that details the specifics of what that journey entails. We will, of course, regularly check in with you during the entire recovery process, ensuring that you feel fully supported the whole time. If you've got any questions regarding any of the information we've provided, please don't hesitate to give us a call so we can answer them for you. Thank you for listening to this MedBelle pre-consultation video. We wish you the best of luck with your consultation and we can't wait to find out how it went.